Hi, I'm Dr. Jeremy Webster. Today we're going to talk about joint pain relief. There are many causes of joint pain. Damage to the joint itself is an obvious cause of joint pain. Inflammation to the joint, as well as inflammation throughout the body, can be another cause of joint pain. A lesser known cause of joint pain is decreased motion or improper motion in that joint. You see, one of motion's jobs, motion in a joint decreases the expression of pain. Sometimes when you have a joint such as your elbow that won't move through its full range of motion, you'll get increased expression of pain in that joint regardless of inflammation or tissue damage in that joint. Now when you have damage to a joint, decreased motion and or inflammation in a joint, oftentimes it will lead to a process called arthritis, where scarring and calcification builds up in the joint. Arthritis can be another cause of joint pain. To relieve joint pain, it's very important to get to the cause of the joint pain. Deficiency in aspirin is not a cause of joint pain. In fact, taking aspirin leads to increased scarring and increases the rate of arthritis. There are also other side effects of non-steroidal anti-inflammatory drugs such as aspirin, Celebrex, Vioxx, and ibuprofen. Some of these side effects include gastrointestinal bleeding, heart disease, and death. In fact, the New England Journal of Medicine conservatively estimates that over 16,000 deaths a year occur from properly prescribed non-steroidal anti-inflammatory drugs. I think these drugs should be used very sparingly, only if absolutely necessary. To address some of the issues of joint pain, we need to directly address them. If there's damage to the joint, that joint needs to be healed. Rest, ice, and nutrients that provide the actual substance that the joint is made of is the best way to address damage to the joint. Some of these nutrients include glucosamine, MSM, and vitamin C. Now if you're going to take large dose MSM, I do recommend you get professional care so they can get the dosage right and so that they can prescribe the proper form of MSM. If there's inflammation in the joint, a great way to do this is get inflammatory foods out of your diet. Sugar, corn, wheat, dairy, and shellfish are all very, very inflammatory. Sometimes just by reducing those foods, you will reduce the inflammatory response in your body and you can reduce joint pain and relieve joint pain. If you have poor motion in your body, that's best addressed by a chiropractor. A chiropractor can induce proper motion in the joint and then rehab that joint to strengthen it and maintain proper motion. Oftentimes, inducing proper motion in a joint will oftentimes be the best way to relieve joint pain. And if you have arthritis, the best thing for that joint is motion. Although motion may be very uncomfortable at first, you have to move that joint, otherwise arthritis will continue to build up. I'm Dr. Jeremy Webster. I hope this video on joint pain relief has been very educational and taught you a little bit about different ways to relieve joint pain.